Hi, so if you've been following me, I have created a small video about bacterial vaginosis, what it is, and the things that will put you at a higher risk of developing BV. But due to how common BV is, I have decided to speak about it a little bit more. About 50% of women who develop BV will not have any symptom, and the other 50% who have symptoms do have the very well-known fishy smelling vaginal discharge. It is not usually associated with any itching or any pain or any discomfort, just the fishy smelling discharge. It is usually white and homogeneous. The thing about BV is it is more than just the fishy smelling vaginal discharge, which is obviously very uncomfortable. When you have BV, it puts you at a higher risk of contracting sexually transmitted diseases, and that includes HIV. And when you are pregnant and you develop BV, you are at a higher risk of late miscarriage, meaning miscarriage in the second trimester. You're also at a higher risk of giving birth earlier than you are supposed to. That means preterm birth, preterm labor, preterm rupture of membranes. And after giving birth, you are now at a higher risk of developing endometritis, which is the inflammation and the infection of the lining of the uterus, which we call endometrium. BV also causes, low birth weight. It puts you at a higher risk of giving birth to a baby with low weight. And also, if you do have gynecological operations and you have BV, you are at a higher risk of developing infections, which is why the conversation about BV is important, and it is a conversation that needs to be had. If you are not symptomatic and you are not pregnant, you may not always require treatment for BV. But if you are symptomatic, your doctor, your gynecologist, or your GP, or at the sexual health clinic, they will treat you if you're symptomatic. And also, if you're pregnant, whether you're symptomatic or you are not symptomatic, when you're pregnant, you need to get the treatment for BV, because I've already mentioned some of the stuff that BV is associated with, some of the complications in pregnancy that you can have when you have bacterial vaginosis. Routine testing, bacterial vaginosis testing in women who are pregnant should be offered. There is a recommendation in many healthcare systems, including the one that I'm working in. If you already have BV and you are taking treatment, you are on treatment, avoid the contributing factors that include, the stuff that I had already discussed in the other video, having unprotected sex, because we know that semen kind of destabilizes the pH of the vagina. So if you're going to have sex, use condom. And also other things that can help you is being with somebody or having sex with a man who is circumcised. Yeah, and avoiding using all those chemicals and douches and soaps to try to get rid of the smell. That's the last thing you want to go to if you have BV. Treatment alone and just using water is more than enough when you have BV.